Gonna make the world a better place. Gonna make the world a better place. Gonna make the world a better place. Gonna make it home.
All right, here's the deal. People come in all the time. Your mic is too high.
You're leaning back.
Yeah, like you're. It's like a penis is in your face. it just. So awkward.
Way to take it.
Don't let it touch. Yeah, don't let it touch me.
I mean, my response was not gonna be appropriate, so let's not go there.
Yeah, it's true. Okay, I'm sorry. No, here's the thing. People come in all the time, right, talking about the remedies that they use for different issues with their feet.
Mm-hmm.
So I just wanted to see what your opinion is on this particular remedy. Okay.
Apply toothpaste on your feet, and the next day, you won't believe the results. Manicurists don't want you to know this, but today,
Why?
I'm going to tell you in this video.
What is
I'll
that?
teach you two
Mayonnaise?
powerful tips with toothpaste, that will
Toothpaste
surely
and
change
salt.
your life. For the first tip, let's put 3 tablespoons of salt in a container. We'll use salt because it helps prevent problems with the nails and the skin around the nails, also preventing and eliminating fungal formation.
Salt, just salt. Okay.
Another ingredient we'll use is
Toothpaste.
toothpaste, of which we'll use only
I like
1
how it's
tablespoon.
so specific.
You can use any toothpaste.
Like
One
toothpaste.
tablespoon.
Now let's mix it very well. And
How
this
do they know
mixture
that was
we're
1
preparing
tablespoon? They
can
didn't
be
measure
used
it?
They
on
didn't measure it
both
out at all.
fingernails and toenails, because toothpaste helps eliminate yellow stains on the nails.
Oh,
Those
because it
stains that
removes
are
yellow
caused
things on
by
your
the use
teeth?
of nail
Yeah.
Because it's the
polish
same
or the
stuff.
constant
Your
use
teeth
of
are
tight
bones.
trees. The other ingredient we're going to use is coconut oil. Let's add just 1 tablespoon and then mix well.
Is making
If you don't
this.
have coconut oil at home, you can substitute
How do you
it
know
with
this?
olive oil. Coconut oil helps in the formation of nails, making them grow strong and healthy. Once everything is well mixed, just apply the mixture directly to the nails. Apply it gently, doing it this way. If you use this constantly, you can enjoy strong, hydrated, and very
Like-
beautiful nails. And the best part is that this will happen in a few days. After applying it to the
This
nails,
is so
you should
wrong.
leave this
Like, here's my thing though. How do you know that you've mixed it well enough? One, if you're not taking accurate measurements, how in the world do you know?
You can't assume that toothpaste is going to whiten your toenails. They're not teeth. Teeth
Bro,
are bones.
Here it is. Don't put toothpaste on your toenails. Just don't do that.
That's-
it's like when people say I put bleach on my feet. I'm like, what? You're throwing bleach on your feet? Like you're just going all in? No problem. I mean, I understand that toenail fungus is hard to get rid of, but
In 2 days. Toothpaste.
It's not happening
Do it
in
in 2 days.
2
You can get rid of
days.
it in 2 days.
2 days. Hit that
Using
Colgate.
toothpaste.
A Colgate
What about
stocks
Crest?
are about to go.
What about Crest?
Yeah, Crest is pissed right now.
What about the whitening one? I wonder if that works better. You should know. You know what that should do is put the whitening strips on.
Put the whitening strips on your toes. Here's the thing, though. I'm like, how did you even come up with that concept? Like, what made them think?
Because
Like,
they
I'm
got
gonna
nothing
mix.
else to do.
I'm gonna. You know what they went? They went to Dr. Google and they were like, all right, I'm
What
gonna
can
mix this
whiten?
up.
What can
whiten
lighten
my
yellow?
toenails?
Dang.
And we've
This is
seen
what
some
society- this is society.
gnarly toenails, but that and trust and believe it's not getting rid of that
They
fungus.
should do
in
that.
a few days.
Laser. That thing I bought for my teeth.
Why'd you make that face with your mouth?
Because you have to put that mouth guard in.
Was that your? It's so true. It's like. Why's your face like that? Yeah, you're drooling. Yeah, you're drooling. Like, are you all right? Like, you just swallowed whatever was supposed to go in your teeth. You swallowed it. Are you okay? You may not live tomorrow, but your teeth will be white. Like, dang. It's the same thing for your toenails.
No, it's not.
Yes, it is. Put that Colgate on your toenails.
Get that bleach.
Get that bleach
That's
out.
where they maybe got it from. The whole thing. Bleach. Don't
They
do
might
it.
have.
Please don't do it, though. We're just joking. Don't do that.
No, we're totally.
See your
just joking.
podiatrist or doctor. Not a dentist.
This is not medical
This
advice
is
at all.
not,
It just
yeah.
I wanted to see your reaction because, like I said, we get crazy remedies from people all
Yeah.
the time. You know what I mean? Like I said, my craziest is bleach. I don't know if you've heard any other.
Bleach is, I mean, that's like the common one, but it's no
Yeah.
one knows the ratio for bleach. I mean, I don't recommend bleach ever. And hydrogen peroxide, I don't like. I mean, there's just the things that people do, but oh man, that hurt my stomach. That's funny.
It's wild out there. Wild West. Instagram has changed the game. You can get all your healthcare information just by going to TikTok or Instagram.
Oh, yeah.
Colgate for your toes. After you've done brushing your teeth, I mean, you just spit some Colgate on your.
What about mouthwash? They should just dip their toes in the mouthwash.
Yeah, get
That
them
could work.
extra fresh. But I feel like even patients will bring up the fact that they come in to see me because they want to get their toes right, because they want to make money off of this foot fetish
What are you
stuff
talking about?
online. Well, you haven't heard about this? People generate.
You have people? I mean, I know that. I mean, we know about your really
Do you?
raunchy patient. I mean,
No, I'm talking about, do you know that people are actually making money out there selling foot pictures?
of course, I'm sure they do.
Like, it's wild.
There's a lot of fetishes out in this world.
Like, I literally had a
I
patient who
try
came.
not to.
I know, it's crazy. I had a patient who came in and was like, I need my toenails trimmed because I need to make $1,000.
I know this patient is really. This is like makes my skin crawl talking.
I'm
to this
just
patient.
saying. I was like, dang.
It's
Like,
okay. My patient called me today talking about a dog. That's it. Just a dog. Wanted me
oh,
my
so
advice.
now you're a podiatrist.
I'm a friend. He said, "Is
And
Allie
a vet.
available?" And Ash goes, "You mean Dr. Allie? She's with a patient."
Nah, man.
No, well, I need to talk to her. Okay, you can schedule an appointment. It's time sensitive. What? And it was about a dog.
It's crazy.
The size of our dog and if he should get his dog.
What you should have responded is, this is out of my scope.
Oh, I should have. I'm not a vet.
I'm not a vet. This is out of my scope of practice. Like, what are we talking about
And I
here?
said, get the dog. And he goes, well, that's you as a woman speaking, not the doctor.
So whoa, dang. All kinds of wrong thrown in there. Like, what are we talking about? Bro, you just called me in my place of business.
like,
I'm working. And that's what you're going to hit me with?
Yeah.
Ah, man. Life. What else has been going on?
We had a good weekend.
We had an awesome week. We
Guys,
got a lot of stuff
we
done.
lifted 10,000 pounds of garbage out of our house
Yeah.
this weekend. It hurts. My body hurts.
Here's the thing, though. Some people may say, why did you have 10,000 pounds of garbage in your
I mean,
house?
we're
to begin with?
remodeling. It was all of our walls and
made
our
that-
flooring.
Made that clear. We're
Let's-
not hoarders. We are not hoarders, but it was a lot of trash that we removed. It was very therapeutic. I don't know about anyone going to the dump, except for if you have a trailer.
You did really good.
I ended up maneuvering the trailer.
We only got in 2 fights.
Yeah, that was it. But we
That's actually
we
good.
survived it. Yeah, and the guy at the dump was like, "You're getting better." I was like, "Oh,
It was cute.
I appreciate you, man."
The girls were in the car. Good job, Dad.
And Chili had her head out. Our dog was like, "You're doing it." I'm like, "Oh my goodness."
It was
this is
awful. I
crazy."
literally sat down when we were dumping the stuff. I couldn't. I had to
Yeah.
take a moment. But then the smell is so bad in the dump that you can't stay there too long.
I still feel like it smells better at the dump than toe jam smells.
Oh, we don't need to talk about toe jam.
I think toe jam is the
the
grossest
worst.
smelling thing
It makes me gag
ever.
every single time.
And
every
people
single time.
will laughing. They're like,
They don't even know.
how you doing down
They
there?"
don't
I'm
even
like,
know.
"I'm
I
barely
take
surviving."
my tweezers or whatever I'm using, my nippers, and I pull out these big things of toe jam, and I'm like, how do you not smell that? It's literally making me gag. It's worse.
crazy.
I mean, we've seen necrotic feet, we've seen maggots, we've seen like all of it. And toe jam by far still is the worst.
I think toe jam smells worse than having maggots, obviously, because the maggots are eating the dead flesh from the
It's just
tissue.
awful. It's
But
so gross.
it
And then it stays in your nose hairs.
does.
I did have a bad wound last week that like resonated in my nose. I hate that when that happens.
I was driving to work today and I was thinking to myself, I was like, wow, like there's times where you're cutting toenails or you're doing stuff, right? And things just hit your face, like, or just a piece of toenail just flies in your mouth. Like, oh,
Ew, yeah,
like,
that's why you don't talk.
I try not to talk, but you're engaging and you're just,
No, but then you're like, that's when you tell the people, sorry, I don't talk because I've had them throw in my mouth.
I have to use that tactic.
I do.
That's actually really smart. I mean, I guess you could still wear the mask.
Yeah, but if you don't, because you can't, you're like screaming at these people. They can't hear you. You have to pull down the mask anyway.
Yeah, it's true.
So I just don't say anything. And then they all laugh and are uncomfortable. And then like grossed out because I've said that that's happened. It's happened. They get in your
has
eye.
happened,
It's
yeah.
gross.
I'm sorry. I just thought about a toenail as I was swallowing my tea. Baby gag a little
but
bit.
your tea string was like right
I know,
here, and it looked like you were slobbering.
No, it made me feel weird too because it was like the sensation of a nail flying on your mouth. I didn't know how to react.
Stop it.
My bottom lip just started quivering. It was because that's how you feel in the room, but you have to smile.
Remember when you got a scar on your face? You
Bro,
were
I have a
so
wound. Thug life. I'm so pissed.
You were so
I
mad.
scratched my face, bro. I still got a scar from this day. I have a skincare company sending me some products though for
I'm excited.
hyperpigmentation.
Yeah, I'm excited. I got it.
So hopefully it'll take care of that wound. Hey, it's hard out here in the streets, bro. Like this is the stuff that happens.
What was it? On Friday when we were at the veterans home, I wasn't wearing my glasses. I had my contacts in because it was sunny. And the guy was like, "Why don't you have glasses on?" He's like, "You need to get goggles. What are you doing?" I was like, "I got it. It's okay." But then the whole time you're clipping, you're like...
You have the lashes to protect you at least. You just flutter your lashes like this.
Seriously, I mean, you gotta really be like blinking the whole time.
No, it's crazy. Toenails are just a part of what we do, though. People ask all the time, like, "Oh, so you have a foot fetish?" Like, don't have a foot fetish, but toenails is a part of what we do.
No, what
It's
my
a
fetish
service.
is not really a fetish because that's not appropriate, but it's to make sure that these people are walking comfortably and pain-free.
Yeah.
How many patients don't walk because their toenails hurt? Or it's not their toenails hurting, it's their toes are hurting because their toenails are too long or thickened. But I had a patient a couple months ago who literally thought he needed surgery for his foot, like a full like big toe fusion because he had so much pain. And it was literally because he had an ingrown toenail.
Wow.
And all of his pain was reduced. I mean, and he was a big baby. He was almost crying in the chair. I was trimming this toenail out, but he felt immediate relief, walked out of the clinic, and he was totally fine.
I think that's the best part about our job is that people will come in with an issue and you can provide immediate relief. Some specialties it's not that way, but in our specialty, right, someone can come with a specific injury, a specific diagnosis or pathology, and there are things at times that we can do to give them relief that day. And so it is pretty cool,
Well, and we also, as a practice, we try to get people in as soon as we can because we know how important it is to be able to be on your feet, to continue working, to make the money that you need to make to continue feeding your family. So
you got to go and make that money of those pictures of your toes. I mean, you got to get it in. You need this to get you right. So you can
yeah,
get
but then
it.
you have the patients who are to ask you to do a pedicure, and you're like, no, I
hit
had
the
someone
foot
ask me
massage,
about
massage?
last week. You should literally the patient was like, you should paint toenails, and I was like,
You need a cosmetology license.
and
They
I
don't
said I
realize
can't
that.
do that. I would get in trouble for it. I literally can't do that, and I don't have time for that. What do you mean? I could not believe. I was like, wow, you really? I mean, I do surgery. Like I do these things. Like, no, paint your toenails.
Hey,
No,
you're cutting them. You might as well finish off the job.
yeah,
And paint
like
them.
I have an extra 10 minutes to paint toenails.
Yeah, I mean it
was
an
like the
expectation.
audacity. I don't know, whatever.
The audacity,
Oh, girl.
the audacity.
Oh man.
They hit you with audacity. Hit the nasty on the toes. Go toe, bro. Anyways, yeah, that's really what's been moving and shaking in our world. Nothing big. Slowly chipping away at the house. The house is coming along nicely.
Yeah, we're excited. The installation's getting installed this week, and then the drywall, and then flooring.
Yeah, flooring is going to be huge.
We've hit the corner of all of it out. The demo is over.
Yeah.
So now it's turning the corner to really start filling everything in, and then the design really comes through, which I'm really excited
By the way,
about.
this wasn't just like hey, we should remodel our house. This was kind of a forced remodel. We had a leak from our dishwasher. It's a pretty sensitive topic for me because I'm like,
let's not talk about
we're
it. It
not
wasn't a
gonna go
leak.
in.
It was a much bigger situation.
It was. But anyways, ruin our hardwood floor.
We have a hole in our ceiling downstairs.
Have a hole in the daylight basement. We decided we should get a new dishwasher, and then we were like, well, if we get a new dishwasher,
The
then we
cabinetry was falling off.
That is true. We literally had
And our
piece of the cabinet
oven
that
was
wasn't
from
on.
the 1970s.
the whole house. But we had a cool 70s vibe. And for me, it was just like, I was thankful to just be in that moment.
It was a very livable house for the time being. And
Yeah.
it was. We didn't need to necessarily do anything per se, but
No. But
I'm
things
excited.
happen. It
It'll be fun.
changes, and it's a new chapter.
it's a little rough. We had the drywall removed over the weekend, and the guys broke the sink. And like the drywall fell down, right? They're removing the ceiling part of it, and because it's old plaster drywall and it has to be removed to get new. Well, it fell and broke our faucet. So this morning, I don't even know how to It was like supposed to be in the sink. You know how faucets are
Do
like
you know
this?
how hard it was to set that up properly?
I'll
You
put it
just
back.
move that?
I'll
Oh
put
my
it back.
goodness.
This is the faucet in how it's normally supposed to be. This actually doesn't look very appropriate.
No, it doesn't.
But now it looks like this.
Can I demonstrate it?
No, that's even worse.
Oh, yeah, it's true.
Literally, the faucet is like that. So
That faucet needs some
anyway,
help.
I talked to YG and it's getting figured out.
Yeah.
But it's integrity. You got to tell people when stuff like that happens because you thought that I wasn't going to notice my sink was not working. I mean, it works, but it's like
Things
So,
happen. I mean, it's a part
so
of the
anyway,
process.
we're getting it figured out and it's all fine. But
Yeah.
she's in agreement and everything works out. It just was not what I was expecting to see. But it's at least the sink still works though.
We can wash dishes.
Yep.
I mean, it's important. Now we need to wash some clothes now that our washer and dryer.
You see how I was
up and-
smiling and then I wasn't smiling? I hate laundry. Laundry is like the worst part of my day.
Is it because there's just an abundance amount? Like
Yeah,
having,
it's 4 people.
I assist in the laundry. I do assist
I
in
love
the
you,
laundry.
But you want to know how you assist in laundry?
Oh, you're gonna put my laundry game on blast?
I won't, but you try.
Listen, okay, here's the reality. Like, I get the laundry into the washer, and there are times where you could potentially forget that they're there for a day or two, but it's not intentional. It's because we're running all around. And then my wife comes and she's like, "Bro, this has been in here for like."
We had to
3
rewash
days. Like,
laundry
what's
this
going
morning.
on?"
It's because you don't tell me and I don't know.
You know why? Because I'm really trying to be a proactive husband, and I'm like,
And
I'm gonna help out.
And that's why
get
I don't
this
say
laundry
anything.
done.
But then I have to rewash it.
And then squirrel, I'm off, and I'm like, oh, I had laundry in there. So you know what? Honestly, it's a kudos to you because of everything you're able to handle and how you're able to multitask. Like, I'm a decent multitasker. I'm not saying I have the multitasking skills of my wife by any means, but
Babe,
it's
you
just
are
hard.
not either.
I'm great at it.
Okay.
Absolute professional.
How many things do you think you can multitask?
I'm thinking
at a
about
time?
one thing right now.
Ah, yes. Point proven.
It's
Oh my
true.
gosh. No, so laundry, it's just a lot. I mean, it's the separating, the washing, the folding. We have a huge laundry basket, like those big things from Costco, and it's full of socks. Socks are the worst. I hate socks.
It's because they get eaten somewhere in the process.
Oh, and I have a husband who puts his socks in balls.
Is that a thing? Is that a thing? Are you not supposed to put your socks in balls?
In the laundry? No.
Listen, my thing is, I
They
feel like
cannot get washed.
I understand that, but I feel like if you don't ball it up when you throw it into
Jeremy, it's not a basketball hoop.
no, the laundry basket, I feel like that's how a sock is lost.
So then who has to undo it?
But at least it has a match.
Stop it.
That's how I feel. At
No,
least its
because I'm not
partner's there.
looking at it.
Its sock mate is with it, or
And your
else it gets
sock
lost.
dirt is with it and it doesn't get clean.
No, but the thing is, it's because you have to.
No.
You can't just dump all the laundry into into the washer. You have
Okay.
to literally.
So you can do the laundry.
I have been. That's why it's not folded downstairs.
At least you're honest. It's
I'm
awful.
honest, yeah.
It's
So,
awful. But at least we have a washer and dryer. I feel grateful that we have a washer and dryer. We did not have a washer and dryer for like 3 months. And we were having to go down to my parents' house, which again, grateful that they were next door, that we had that capability to do it. But it's rough, man.
You know what I'm going to start? You touched on something that's huge. Grateful.
Mm-hmm.
I had a patient that was telling me that they started a gratitude journal.
Yeah.
And I was like, that's crazy because our friend was just
Jen.
telling us, that
Every morning.
she has a gratitude journal.
Every
And I think
morning. She
that's
said
really
it's
important.
learned, right? Gratitude is learned. And
like-
you have to know it as a skill to be able to say, I'm thankful. I appreciate it. This was
Yeah.
not, it's not, I mean, a lot of the things that we do is what we have earned to this point. And the hard part now is like making sure our kids are not the expectation of like, well, this is what just life is. And,
Yeah.
you know, the privilege and all of that is really important for them to not assume and understand what the real, what real life is for most people. And so The gratitude journal is really sweet. The girls have gratitude journals, actually.
We need to
We really need
be
to
more
implement
consistent
that.
with that.
Yeah.
Because I think it's a really, really great skill set. I mean, I was telling my patient, it's so easy to get lost in the woes of what's going on with yourself and other people.
To go back to the laundry thing, I remember last week we were talking about this.
You can't move past the laundry.
No, but this is a good part.
Okay,
I just feel grateful to have clothes to wash,
yeah.
right? Like you have
I've
to
seen
go
that.
back to that basic part of it is that there's people who don't have clothes.
There's
to
people that
even
don't have a
wash.
washer and dryer.
Well, I know.
You're hand washing, right? I mean, there are
So
gratitude.
it's just taking it down to those really basic
Yeah,
things.
we're thankful that we have food. We're
food
thankful
to
that
cook
we
with,
have we have
you
a
know.
house that we can.
that I have dishes that we used with food to wash in my broken sink.
That's getting fixed.
That's getting fixed.
Yeah. Oh, it's true. And so mindfulness, trying to practice that mindfulness, gratitude, being thankful,
Present,
and then
being present.
being present, right? We recently cut our hours down from 8:30 to 2:30 because we felt that we needed to take time for ourselves to heal. You get caught in trying to make sure that you're helping everybody else and everyone else is getting better, and then you get lost, right? Self gets lost, and there's always, people will say the saying as far as service over self. And at first I was like, yeah. But then I'm like,
How do you serve if you don't have self?
correct. Like, how am I going to serve if I'm not serving myself and feeding myself, whether that's spiritually, emotionally, physically, right? Like, I have to be able to make sure that Dr. Jeremy's okay in order for me to go out there and really help people.
Well,
But-
and the hard part with medicine and just going through this process, right? So we're talking about changing our patterns to try to get into what's more applicable for this phase of our life because we've been living in this fight or flight for so many years because of med school and residency and just trying to get to this point. And medical school and residency teaches us or taught us to
All gas, no break.
work. Yeah,
Yeah.
like day in, day out, 12, 15-hour days. And there was no time. And that doctors are working 70, 80 hours a week. Well, residency now allows, you can't do that, but look at what was, and that's what the standard was. And if you don't do that, then you weren't working hard enough or that you're not doing enough and you're not enough. If you don't overwork, this is what society is. This is what our generation, like what we're learning, the 40s, 50s, we're late 30s, like that's what we're experiencing is that you have to overwork or you're not working enough.
Yeah, you're not working hard enough.
And so where is self in that? Like that, and trying to understand that that's not how it has to be and that we're okay if we take a step back and actually focus on ourselves and our marriage and our family and our life, like that's okay. And trying to get out of that societal impingement of that is very difficult.
I mean, I got to be honest, for me, it was so hard because I was like, man, my battle is if you're not working hard, then people can stereotype you, and especially people that look like me, and well, you're lazy. And then if you're pushing on the gas, then it becomes like, bro, why are you always going so hard? And it's like,
Why does it have to be a label? It's always label.
It's always a label. I'm like, so I have to, at times, I have to go 150% to feel equivalent in so many situations. And when I do that, people are like, well, take a break, take time for yourself.
But who are these people?
And you're like, that, I mean, just interactions with friends, family, people that, acquaintances. And you're just like, why, like you said, why does there have to be a label on top of that? You know what I mean? Like, maybe I'm just going hard at that point because I have to go hard.
Well, there's seasons, right?
Yeah.
There's definitely seasons, I think, and where we worked really, really hard to be able to get here. And now that we're here, we have to make sure that we reassess and kind of say, hey, okay, that push to the pedal or push to the metal or whatever that is doesn't have to be the same. That doesn't mean that we're not working hard. That doesn't mean that we're not focused on our careers, but we also need to kind of reevaluate and say, hey, work smarter, not harder, where now we have a little bit more flexibility to do that. Whereas when we were in med school and residency, I mean, we were living day in, day out of that fear of we don't know what this test is going to be. We don't know how it's going to go and how it's going to play out. And we're taking all these loans out. I mean, we talked about that recently is, the leap of faith that we had to make to even start med school. We didn't know. We had no idea what could happen if we didn't make it through. I mean, we just we weren't even letting our mindset get to that point. I mean, you have so many people start med school and don't finish. They still have loans.
Yeah.
I mean, our med school, 60 to 80K a year. So you're in like $150,000 of debt, and what is there to show for it? You have nothing. 2 years of med school, that doesn't get you anything.
Oh yeah, for sure.
And so it's just that level of dedication. We had no choice. I mean, and we know that. And so now, okay, well, we checked that box, that little box that society said you got to check to make sure that you have a foundation. Okay. But we don't have to still live in that and
in that space, yeah.
Balance. It's not all that balance.
Absolutely. Well, guys, thanks for joining us on Footprints to Blueprints today. We went over some alternatives that people are using for their foot health. Not recommended. We also talked about some of our DIY projects that are going on at the house, slowly chipping away at that, and how I'm an excellent husband that also does laundry.
Single tasker.
Thanks for joining us, guys. I'm Dr. Jeremy Cross.
And I'm Dr. Allie Cross.
And this is Footprints to Blueprints.
Gonna make the world a better place. Gonna